Welcome to In a Heartbeat, coming to you today from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. I'm Dr. David Balle, and I'm your host of In a Heartbeat. I'm so pleased to have with us as my special guest, Dr. Allison Jay. Dr. Jay is a cancer genetics expert, and she does her work at St. John Hospital and Medical Center here in Metro Detroit. And I'm so pleased and honored to have her as our guest.
Thank you so much for having me, Dr. Balle.
And welcome to In a Heartbeat.
It's a privilege to be here. Thank you.
It's great to have you. So, Dr. Jay, why don't you tell our audience a little bit about you, your work, and your role at St. John Hospital and Medical Center?
So I'm the director of the Cancer Genetics Program at St. John Hospital. We have 3 locations where we try to accommodate our patients: in Grosse Pointe, in the Warren area, and also in Rochester Hills. I typically see individuals who are concerned about their risk for cancer. In terms of my training, I did my genetics residency at Detroit Medical Center, Wayne State, and then I completed a fellowship at the Mayo Clinic before I came to St. John, Maine.
Amazing.
Yeah, thank you. And I've been here for 2.5 years, and we're excited at how our program has grown and been able to help many patients.
So maybe you could tell us, how has your program grown, and was there much of a program to start out with?
When we first started, there was about 3 patients a week, and now we see over 20 a week. So it's been really rewarding to get to see people and help them with their journeys. A lot of people come in and they're concerned about the cancers in their family, their own risk, and they're looking for answers. Because the end goal is we want to help prevent cancer in these individuals through appropriate screening, so no one's blindsided by cancer. So that's really our goal.
Dr. Jay, in sort of basic terms, what is genetic counseling?
That's a great question. Genetic counseling involves meeting with myself or a genetic counselor, and we take information about your family history. For example, do you have a lot of family members with melanoma at early ages? That could be concerning for a hereditary skin cancer syndrome. Are there individuals who get breast cancer or ovarian cancer? So we go through and take a very thorough family and personal history, and then we try to make you aware of your own risk for getting cancer and see if there's something in the family that is in the genes. We've all heard about DNA that can help predict your risk of cancer.
That's great. And so when a patient receives this information, where do they go from there?
So normally they come in and we see if a blood test to do genetic testing is warranted. So it's a blood test that will tell us if you're at increased risk of cancer or not. And then we sit down with you and we counsel you about the game plan. How do we give you the best care? So you're not left alone with the results. We make sure that you're coordinated follow-up with either a breast surgeon if you're at increased risk of breast cancer, if a dermatologist if you're at increased risk of skin cancer, or ovarian cancer. We make sure you have the appropriate physicians who are working as a team.
And so the benefits of genetic testing are that, it gives you a heads up and allows you to be prepared and look out for things that you may not necessarily be aware of.
That's exactly it, Dr. Balle. So for example, I had one patient who came in to me whose sister had breast cancer in her 40s, and then the mother also had ovarian cancer. And so we did a blood test on the sister, and she was found to have a BRCA mutation. Some people in the audience might be familiar with Angelina Jolie. Her mother had ovarian cancer by 50 and passed away. Her grandmother had ovarian cancer. Her aunt had cancer. And Angelina Jolie was tested and was BRCA1 positive. Angelina Jolie chose to be proactive and have her breast removed, and she got implants, and have her ovaries removed. So my patient had the same test that Angelina Jolie had and was positive. And instead of waiting for cancer, she was proactive. And it's an individual decision, but she did have her breast removed and has been very happy with the results and feels empowered. And she also brought her daughter into me because she didn't want her daughter to be blindsided. So her daughter tested negative, so she didn't have to worry about those increased cancer risks, was relieved, and didn't have that concern the rest of her life. So genetic testing is really a gift for the entire family, because then you can kind of not be as concerned about cancers and be appropriately educated.
Before we move on, and for people who are watching who may not know, what is BRCA? And
So-
what does it mean when you're BRCA positive?
Sure. So I think about BRCA, it just stands for breast cancer 1 gene. And it's instructions for tumor suppressors. And the way I think about it is we have policemen in the body that fight damage. So if you have a mistake in your BRCA, your policemen are running around, but they're not able to do things as effectively. It's kind of like they're running around with their heads cut off. So you might not be able to fight cancer as effectively as the average individual who has a working BRCA1 gene. So it's basically a blood test that will just predict if you're at risk. It's not saying you're necessarily going to get cancer, but you do need to be watched more closely by a team of healthcare professionals.
And I think you've touched upon this a little bit, but I wanted to ask you specifically because I think a lot of people are not familiar with genetic testing. How do genes and heredity affect cancer risk for children?
That's a great question. So genes, we each have one set from our mother and one set from the father. And so if there's a mistake in one of those in the parent, there's a 50-50 chance their children could have it. So we typically don't test children until they're adults, like 18 to 21, when they can be educated about the risks, except for some unusual cancers. But if it would help their care, we definitely test them.
And so for people who may be watching or patients
Sure.
in general, who really is a candidate and who should get testing, or is it okay just to get tested if you're curious, or if there aren't necessarily risk factors that you know of? How would you address those questions?
That's a great question. In genetics, things are changing tremendously. There's new technology where they can test all 20,000 genes in the human genome, and some adults are choosing to test that to get all their information. In my area of expertise, I typically only test individuals who have a family history of early onset cancers. So breast cancer less than 45, male breast cancer, ovarian cancer, if there's a number of skin cancers in the family. So people with certain red flags. And then sometimes if somebody's been adopted and they want to get more information about their cancer risks, that's also a consideration. And we can help coordinate testing so that they have information about their cancer risk.
Are all cancers inherited, and if not, which ones are?
That's a great question. About 5 to 10% of all cancer is hereditary. So if I see 100 women or men, only 5 come back positive with these tests. The other 95 are negative. So most cancer is sporadic. Damage occurs over time. So oftentimes we see cancers when people are older, and it's the accumulation of damage. And so we always educate patients that about 35% of cancer is diet and environment, with one of the most significant exposures,
so what are
tobacco.
those percentages again?
About 35%
35%.
of cancer is diet and environment.
That's an amazingly high
Number.
percentage.
Yeah.
So would you be able to tell us, what in our diet, if known, and what in our environment, if known, contributes to that?
I think people have said, more fiber can be protective for colon cancers and things like that.
Mm-hmm.
In terms of our environment, we know aniline dyes with hairdressers can increase risks for cancer, sometimes benzenes that people are working with. Tobacco, which you well know, is one of the biggest exposures. So if we just eliminated that, that would greatly reduce lung cancers and some other associated cancers.
Mm-hmm.
So it's just helpful to kind of talk to patients and educate them on the different components to cancer. Because after talking to us, sometimes people will come in and be very concerned, but once they hear that most cancer is sporadic, they're less concerned about their own risk.
Mm-hmm. So Dr. Jay, maybe you could take us through a typical visit and say, for example, my doctor said I should see Dr. Allison Jay for genetic counseling.
Okay.
And so I come into your office, and then what happens there?
That's great. So I usually meet with patients for 30 to 45 minutes. I would talk to you, Dr. Balle. I would ask about your brothers and sisters, your children. I would ask if your mother had cancer, if any of her sisters had cancer, and grandparents. And then I would ask about your father's side as well and take a full family tree. And we would draw the family tree and we would look at it together, and we would look for red flags that if there could be a hereditary cancer, or it may be just that the cancers in your family are sporadic. So features of sporadic cancer, meaning it's out of the blue and it doesn't greatly increase your risk, would be maybe if your grandpa had colon cancer at 80, or your grandmother had cancer, basal cell, at 75 and had had significant skin exposure. So there wouldn't be anything necessarily that would greatly increase your hereditary cancer risk.
And so, are any of your are any of these services covered by insurance, or are they not?
So our visits are covered by insurance. So Medicare will cover it, and most insurances, it's just a specialist visit for my 30 to 45 minutes. The genetic testing is about 98% of the time covered by insurance if you meet certain criteria. So when I'm going through your family tree, I'm trying to make sure that you meet the criteria so that the genetic testing is covered. So in addition, we work with companies that will call you if you owe more than $100. So you're not blindsided by a bill if you come to me. We're not looking, people are going through enough. So they will get a call if they're going to owe anything, and they can choose to forego the testing or do the genetic testing.
What if I was coming to see you and, say for example, I was adopted, or I didn't know much about my family and we were going through some of these things? What happens then?
So for individuals who are adopted, for example, I've had a woman recently who had breast cancer who was adopted. They meet the criteria to get genetic testing. And so we normally will order the blood test, and then we get a report and can give them instructions on best cancer surveillance strategies and things like that. We sometimes also ask people to reach out if they had any relatives that they might know remotely, just to get as much information as possible. For people who have limited family knowledge, there's also other strategies, looking at death certificates or trying to get medical records from people who have passed so that they can put the whole pieces together of the puzzle.
And are there any other tests that are done other than blood tests?
There's actually saliva tests. So for those patients who are squeamish or who don't want the blood drawn, they can have scope, gargle it and spit into a tube, or they can just spit into a tube and we can collect the saliva. And it's been validated as equally accurate as the blood. And so that's another option for individuals who want the genetic testing.
A lot of people today, I think, are looking into their ancestors and their websites and commercials that tell us
Right.
so-and-so how we can do that. Is that beneficial at all?
Ancestry.com, I know many individuals use that, and then they can have more information about their ancestry. And that's also helpful because there are certain diseases that run in different populations. So I think more information can be better.
So say, for example, Dr. Jay, I come in to see you, you suggest I get a blood test. I find out something that is helpful and
Sure.
may indicate I'm at risk for a genetic type of cancer. Is that type of information confidential, or who else knows about that and is aware of that?
So we keep the results confidential, and we'll only disclose your results, Dr. Balle, to someone you've asked us to, so maybe another physician and things like that. If your insurance did pay for the testing, because it is about $3,000,
Wow.
they have the right to request the results as well. So we would be needing to disclose that to them just to make sure that insurance covers it. But otherwise, they are kept confidential in your medical record.
So let's say, for example, there's a positive result. Obviously, insurance will become aware of what that result is. Can they do anything else with that? Does it negatively impact my life or ability to get insurance again? Are there any legal protections?
So thankfully we have the Genetic Information Non-Discrimination Act, which is also known as GINA. That was established in 2008, and that prohibits health insurance companies from raising premiums or eligibility criteria using genetic information for that. So you will still be able to get health insurance. There are companies for life insurance and disability that can request the information. So we always educate patients before they get the testing to make sure that they have appropriate life insurance. The Genetic Information Non-Discrimination Act also prohibits employers from discriminating against you based on your genetic information.
In percentage-wise, maybe approximately, what are some of the things that you see most commonly that you're talking to patients about, and what is the array of different things that you counsel patients on?
Most of my patients come for a variety of reasons, either history of breast cancer.
So breast cancer is very
very
big.
high, and I think that's because it's one of the most prevalent cancers. We see quite a few men with histories of colon cancer in the family. We've been seeing a rising incidence of colon cancer in young people. So I've had a number of 35-year-olds, 30-year-olds coming in with colorectal cancer, and it's unclear why that incidence is necessarily increasing, but there's research being done. In addition, prostate cancer in men is quite common, and so some men are concerned about passing on a gene to their sons. And so red flags for hereditary prostate is if there's 3 generations with prostate or a number of men with young prostate cancer, it might be appropriate to do genetic testing. So really the common cancers are breast, colon, prostate, and ovarian cancer.
So we talked a little bit about breast cancer and ovarian cancer. Say, for example, somebody is positive for a genetic relationship with colon cancer or prostate cancer.
Sure.
What do I do with that information, other than have an awareness of it?
Well, I think the good thing is if you find out that there is a increased risk of getting colon cancer in your family, there are guidelines so that you get colonoscopies every 2 years. So ideally, you would pick up any lesion when it was very small before it's evolved and can spread throughout the body and cause much more serious complications. So you could use that information to empower you to get colonoscopies covered, hopefully by your insurance. And it would help with that. In addition, sometimes colon and uterine cancers can go together. So women can take the information from the blood test and go to their doctors and potentially get a preventive hysterectomy so that they never have to face uterine cancer or something like that. So there's definitely actionable things individuals can do with this blood test information. And really our job is to help patients and give them the options and make them aware, and then they can follow up with the appropriate physicians.
Although you specialize in genetic counseling related to cancer, what about, are there also such indications for people who may have inflammatory conditions or diseases such as autoimmune disorders or arthritis, things like that?
Yeah, I think there's incredible research and new genes that are being evaluated and discovered for autoimmune conditions, and there are testing that can be done as well for that.
And as a dermatologist, I kind of know the answer to my question. There are genodermatoses.
Right.
So what about the skin? What's involved in the skin?
So there's a few conditions that I've seen. One is neurofibromatosis, which is a big word, but they can have lesions on their skin that is described as café au lait macules. They're light tan colored lesions. And they can also have neurofibromas and also other health complications. And so we can do genetic testing for that, and it's actually been found that those women who have it have a greatly increased risk of breast cancer.
Really?
So that they should start getting watched at like age 30. So I had one young woman whose mother passed away at 35, and she had NF1. And so we did do the testing, confirmed that she had it, and got her plugged into some of our excellent breast specialists at St. John so that she's getting watched. And so hopefully she won't go through the painful journey that her mother did. And she has 2 to 3 young kids as well. So that's really our end goal, that she'll be around for them.
The blood test that you described sounds like it's fairly highly specialized.
Right.
Does it take a while for the result to come back?
Usually the results take about 2 to 3 weeks. It's amazing, the technology just keeps evolving. I'm old, so when I was in training, I think of the testing as kind of like a payphone. And in the past 2 or 3 years, they've come out with technology like the smartphone, where they bundle a lot of genes on the same blood test. And so just like your smartphone does a lot more and more rapidly, the new technology is about similar to that.
And so In your work and as you've seen things over time, are there any sort of things that you see as sort of trending in your field or directions that it's moving or evolving in terms of what you're seeing or the types of tests that are available?
I think what's really remarkable is that genetic technology keeps evolving and the price keeps coming down. So I think for the average viewer out there who's concerned about the cost, I think that's going to be less of a limitation. And I think genetic knowledge is going to be something that physicians all use so that you can be educated about your risks for cardiac problems, dermatologic problems, cancer risks, and things like that. I was at a recent meeting and they went through, there's new technology that tests all the genes in humans, and a lot of people are choosing to pay for that so that they have that information and can give it to their doctor and have an individualized care plan.
Do you know what something like that costs? Or a range?
Right now, I think the cost is between $4,000 and $5,000, but it keeps dropping, and so there's certain plans that will maybe reduce the cost to $1,000. So in the future, I think it will be more affordable.
I think you mentioned in talking with you that you recently presented something at a national conference. Can you tell us what that was?
Sure.
And I'm sure viewers don't exactly know what that is, and what you presented.
Sure.
And maybe you could tell us about that.
So I felt very fortunate. In addition to my role in seeing adults with cancer, I also see infants in the NICU, which is the Neonatal Intensive Care Unit at St. John. So I was called to see a newborn baby, and the little infant looked, had like an aged appearance, somewhat like an older individual, like in their 80s, but this was a newborn. And so that condition is called neonatal progeria. Progeria means looking old before your time. And so I was very fortunate to work with some experts, and we were able to give the family a diagnosis so that they understood most infants with this condition pass away at 7 months of age. And so we used the new gene technology that I talked about, the exome that tests all the genes, and it was done on a research basis. So it was done for free for this infant and her parents. And we discovered the gene was in a gene that's associated with fat atrophy. So I think what it helped empower the family was it's autosomal recessive, meaning the infant had it because they got one copy from the mom and one copy from the dad. So that way for future pregnancies, they can be counseled that there's about a 1 in 4 chance that it will happen again. And so that they can have that knowledge, because that child had an incredibly tough journey. But hopefully, you know, the St. John NICU team was excellent in giving that baby really the best care. And through working with experts and collaborating, we discovered this gene that causes the condition, and hopefully families.
That's amazing.
And it's a testament to the family. They really helped follow through, and the company, Children's Mercy in Kansas, did the testing for free. That's
amazing. That's a wonderful service. Yeah. And, you know, you made your mark.
Yeah, thank you. And that family,
wonderful.
It's a privilege, because with that testing, when making a discovery like that, you need to test the parents. And so the parents both came in and donated blood as well. And it showed their commitment to kind of having a greater meaning for their infant's loss. So other families out there have that information when they're dealing with a really hard diagnosis.
And so for not only is the appearance that of an older person, but their body on the inside as well seemingly ages very fast or presents as aged, and that accelerates. Is that correct?
Right, with different components of progeria. There's a classic progeria where they have a lot of heart disease and they pass away from that. With the child we had, it's kind of hard to definitively say, because you know the average lifespan is only 7 months. So we don't see, there's only been like a few cases where they live to past 17. So it needs to be more research on that.
And perhaps at the time, you know, maybe not a lot of internal testing is done to see what's going on the inside.
Inside of the infant, yeah. So if they did more, sure.
Well, Dr. Jay, you've been a phenomenal guest, and it's really been eye-opening. And
thank you so much, Dr. Balle.
I honestly, in my own practice, I see a great need for for your services and the type of work that you do, and really appreciate that.
And we appreciate you. We send all our BRCA patients to dermatologists because they have increased risk for skin, and so it just helps reassure them that somebody confident in what they're doing is looking at them yearly to make sure nothing's missed. So
We
thank
need
you.
each other, we need to work together, right?
Definitely. Thank
Well,
you.
thank you so much, Dr. Jay.
Thank you so
Appreciate your
much.
time, and it's been very insightful. And thank you to our viewers as well. As always, appreciate your time that you spend with us and taking time out. Take good care of yourselves and those around you, and have a great day. We'll see you next time.